Hello and welcome to another episode of Below the Hospital, an AMI podcast on sterile processing and the issues that sterile processing technicians face today. I am your host, Garland-Rhea Grisby Sr, sterile processing manager at 000th Health, CPMC, and I'm also a long-standing AMI member. In this podcast, I interview folks from around the industry about sterile processing and ask what some may consider hard questions, but I would say informative questions about our profession. Today, I have the pleasure of speaking with someone who is no stranger to our industry, and that's none other than Frank Daniels. Frank, how you doing?
I'm doing well. Excited to be here.
Well, thank you for joining the show. Frank is Associate Vice President of Sterilization and High-Level Disinfection at VCU Health. He has worked for VCU Health for nearly 9 years, and during that time, helped to establish a high-level disinfection department. He also recently presented at the AMI Exchange. We actually just talked to his co-presenter, Andy Sundet, on the last episode. Frank, welcome to the show.
Thank you. Thank you so much.
So, Frank, before we get into the meat of the interview, can you tell me what it is that you do at VCU Health and how did you get there?
Yes, my role coming into SPD, HLD is 13 years ago. VP approached me. He said, would you like to head up this HLD unit? It's going to be small, just for clinics. I said, absolutely. It's just for scopes, right? Little did I know then that how big it would turn into. But it comes opportunity. So we started off with, 5,000 devices a year. And then just last year, our fiscal year just ended, we did right at 50,000.
Wow.
So, yeah, the HLD unit is booming. And then I guess I proved myself to someone, they asked me to do the SPD, and then, love the adventure.
See what happens when you prove yourself?
Absolutely.
So in our last episode, we discussed borescopes. So as a follow-up to that, from an end-user perspective, what was the development and implementation process for using borescopes at VCU Health like? And as a second part of that question, did you encounter any major challenges?
Absolutely. I tell people to learn from my mistakes because I know every wrong way to do it. So now I finally found the right way. I'll take it back to like 2016, 2017. I had this fiber borescope. Thought it was the coolest thing ever. So I'm sitting there at my desk. And I'm like, oh, check this out. I can scope a scope. But with that comes opportunity because I couldn't send the pictures or anything. This is 2017. Right. People don't remember when there weren't phones around. It just wasn't a way to transfer the images. So I had to run up and down the hallway. VCU is a large campus, so I had to walk 10, 15 minutes with a scope in my hand with this borescope to show people, hey, this is what we're running into now. So then we fast forward to 2022. We're tightening our policies and procedures. COVID happened. So we want to go ahead and start tightening them up because we got a little extra time on our hands. We're not as busy as we once was. So then we're like, okay, well, we're going to start scoping all scopes new to the health system. And then, like they say, once you open Pandora's box, there is no shutting it because you're like, oh, wow, what did I get myself into?
Right.
So when we start uncovering it, and then we're like, okay, well, we'll do scope every quarter. Every scope's going to get done every quarter. Yeah, that wasn't working either. So then we were like, all right, rip that Band-Aid off. We're going to do every scope every time. So starting there, we just finished our 200,000 inspection of flexible scopes. But I can assure you, all scopes integrity are there to the naked eye. And it saved a lot of questions and our patients benefited from it.
That's amazing, right? Because generally we always look at the time that it takes to do a certain task. And anytime you add time onto an already busy technician, it's not easy, right? And then here we're talking about borescopes, and you stretched back to, the fiber one, right? And so looking at that, and then even trying to figure out what in the world am I looking at in here, right?
Absolutely.
Wow. That is great information. So now, what about documentation? What does that look like in the program currently?
So absolutely. So majority of the people now have a instrument tracking base.
Hmm.
So I remember back in the days, again, putting my age out there, where you document it on paper. Hey, but you're documenting on paper in an environment where it's known to get wet. So paper don't hold up the
Right.
water, right? And then all the other good stuff that might be coming on it too. So yes, we leverage our tracking system. Why reinvent the wheel? Reached out to them. We come up with just a scan point, and it's simple as Borescope pass, Borescope fail. Of course, if it fails, it goes right back to manual cleaning, and then we try it again, because it's hard to do everything right the first time around. That's why we
Right.
have the checks and balances in.
Right. Well, that sounds like a great program. So let's talk about the program's impact on operations at VCU Health and ultimately the patients. I just mentioned the time that it took. So, what has it done for your department and the patients? You mentioned that it benefited the patients greatly, but what has it done for the department as well as the patients?
Absolutely. So we both know, we're in leadership roles. It's nothing if your team doesn't have that buy-in to it.
Hmm.
So first is trying to get the buy-in to them, and then trying to give them I call it the warm and fuzzies, trying to make them comfortable with using it. Because if it's hard to use, if they're not understanding it, it's like, yeah, that's cool and everything, but I can't do this.
Right.
So you got to make it easy for them. So we started competencies once a month, and then we backed it to the quarterly. Nothing says I can't do it as frequently as I want. So right now they're set at quarterly. If I see a trend, then we back it down to a month, because we don't want bad habits to develop. But when when my team sees firsthand what the integrity of the scopes were, especially we have kind of like a hall of fame where we take the best of the best and the pictures are put up there,
Hmm.
because the pictures are worth 1,000 words, right?
Yeah. Yeah.
How much is a 30-second video? Then I can see firsthand, oh, this is why it's not going to work. So
Hmm.
getting that buy-in from them, and you can see it like click when we're doing our education. So when someone joins my department, it's a 6-month education program. So by the time you see it, you can see the eyes just pop open, and they're running full head of steam trying to help.
Wow, you said a 6-month education program for new folks.
It
I,
is. So the first month they don't even see the room, because HLD, we're getting a lot of people that's in the world, that I got bankers, I got waiters, I got bartenders, I got people who deliver the trash, pick up trash. They don't know what HLD stands for.
right.
So how can I throw them in the room and say, hey, let me know how it goes, see you later? So for the first month, they don't even see the room. They're learning the foundation of it.
I'm so glad you said that, right? And so for those listening in, that may not understand, why does it take so long for you to train this one individual? It's just scopes. It's just simple. Me and a few of my colleagues would try to explain that to higher ups, as they call it, or senior leaders or executives, and we would explain to them it's not just a 1 week process. And I tell folks, I said, hey, I with all of my new folks, if you're touching scopes, we're going to go through that policy page by page so that you can understand what's in the policy that you should be doing, not just what you're actually doing. And so folks don't understand, well, why does it take so long? So I appreciate you calling that out. And that sounds like an extensive program. And again, you want your folks to feel comfortable doing the job when they're doing the job, because at the end of the day, you're not going to be there right next to them when they're out there by themselves.
Right? And if they feel comfortable, then that only helps patient safety.
Yep, yep. So this next question is for folks looking to establish a Borescope program at their facility. What do you wish you had known before you took that plunge?
Absolutely. So it's not a one size fits all. So what works for me and my setup, because we all have space restrictions. Space is a
Mhm.
commodity when it comes to us, because we're not generating revenue, we're saving revenue at the end of the day, and
Yeah.
our patient safety. So it's like I said, no size fits all. I put mine right after the manual cleaning. And I do that just because, hey, if we made a mistake, I'm only going back one step.
Mm-hmm.
If I put it in another space, then I could be potentially losing money and time. And, who wants to waste money and time in these days when we're all kind of tightening that belt up together, saving money because we don't know what tomorrow brings?
That's a good point. That is a good point. And I've heard those questions too, like, well, where should we put it? Should we put it at the end? Should we put it before this? Should we do it after manual cleaning is the after manual cleaning perfect point, perfect step, because like you said, now you're just going back one step instead of this whole process over again.
Absolutely. And if it doesn't pass manual cleaning, then it ain't going to pass anything else, right?
Right, right. So you touched on it a little bit about training staff. So what about training staff or reprocessing staff in general? In your experience, what works and what doesn't work?
So, we learned with bumps and bruises. So I started off and I was with the staff the whole time. I was in the room, but then what happens? You start growing. So now I got 2 rooms. So now, I try to say I'm an innovative person, but I have yet to try to duplicate myself. But I've tried to run back and forth, and it's like I'm getting way too old to keep running. So getting that buy-in, that 6 months has equal to my average person stays about 4.5 years now. So I don't have a lot of turnover. And you know what? We also, within that 2-year time period, they have to get a certification through one national scopes. So it's either CER or CFER. So we're pushing
Nice.
that. We're helping them along the way because in that 6 months, they got to repeat back every device I have at least 5 times flawless. If they do it 4.5 times, we start over because I want to make sure not just muscle memory, they understand completely why they're doing it. And that's what this program has done. So they touch every piece of equipment and then they touch every device before I let them go on their own.
So folks, if you are thinking about joining Frank's team, not 4.5, you have to do it 5 times flawless. And that's a great model to have. We used to do 3. So Frank's he's destroying me over there.
No, it just seems one of the things like anybody under pressure, they can, look good once
Mm-hmm.
and then look good twice. And then I'll hit them with, okay, let's do it 3 or 4 times. Do it after lunch because then you're not right back to back. So, but yeah, any of my teammates, any scope, any probe that's used, I'm like, okay, I'm good. I don't have nothing to worry about. And that's what I want my patients to feel the same way. They're already in this state of mind where they're coming to procedure, busy hospital. This is one thing I can help eliminate from the worries.
Right. You can actually go to sleep at night. You can take time off and feel okay, not worrying that the patient's safety is at risk. And I appreciate also you saying, hey, we'll do a couple and then we'll come back after lunch. I use that same model, except I would like push it to the end of the week, and then I'll say we're not going to do anything, and come back next week. Come back Monday or Tuesday, and we'll see what you actually retained. Because I can show you now, and you can do it right now, but you let a few hours or a few days go by, and here you have forgot the steps. So that's a plus. I appreciate you calling that out.
Absolutely. It helps with that buy-in.
So, are there any lessons learned or best practices that you would like to share with folks in the sterile processing field or just the processing field in general?
Yeah, I mean, accept change. Every day things are changing. Embrace the technology. Everything has its place. Why not leverage it to help you? Where we have a meticulous setup where I know where every scope is any part of the process within the HLD unit. But let that Borescope help us because now that technology has came so far since 2017, I can send pictures, at the drop of a hat now. So there's technologies out there for AI. AI is that huge word that is everywhere. I can't turn on a computer without one of the AI operating systems saying, hey, would you like to help? Let me help you out today, I mean, that's ChatGPT, that's Copilot, that's everything that's helping you out. AI is the way of the future. Let's adapt it. Let's make it work for us and not against us. Because as I always say, we are in this together. Let's share it together.
Nice, nice. Thank you, Frank. We definitely appreciate you taking the time out of your busy day to sit and chat with us on this episode of Below the Hospital. So, folks, as usual, I hope this episode has been useful. We'll be back in 2 weeks with another episode. If you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcast, YouTube, and Amy Array. Until then, see you when I see you.